So this month we've noticed an increase in the number of patients that would like to register with us. This is partly due to one of our neighbouring practices where the GP has recently retired, so the list has been dispersed and some of the patients are coming our way. The admin staff were spending 2 hours a day on new patient registrations, hoping to register about 12 people in that time, and this was having a negative impact on the other tasks such as the long-term recall. Now that we're in March and coming to the end of the cough year, I really need the patients to be called so that myself and the doctors can review the long-term condition patients that are still outstanding. We chose to use the Plan, Do, Study, Act cycle, which I learned about in the General Practice Improvement Leaders Programme. I really like this tool because it can test small cycles of change to make improvement. In the planning stage, we had a whole team meeting to discuss how we could change the registration process. And admin felt that it would be easier if there wasn't a restrictive time for patients or for the admin staff. So on the appointment book, we just put up a whole day's number of appointments at 5-minute slots. And in those slots, patients could be booked in as and when they arrived. Those patients would then just have their height and weight measured by the admin staff, and then the patient and the admin staff would agree on a mutually convenient time as to when the rest of the registration would occur on the telephone. We agreed that we would feed back weekly to see how this process was working compared to our old process. So in the do stage, we just decided to go for it and went operational for a week, and then we decided to study what our findings were after that first week. In the study stage, we realized that actually this was a really efficient system, and that actually the registrations were being done at 5 minutes rather than 10 minutes, and we had managed to make a 50% saving on admin time. We wanted to make one tweak in that we found that the 15 to 24-year-olds who are eligible for a urine chlamydia test were not coming in to pick up the urine pots because it was a telephone consultation. So going forward, we're going to offer them the urine pot at the first initial face-to-face consultation where they have their height and weight measured, and we hope this will increase the chlamydia testing in the practice. So having managed to release 5 hours of admin time a week, we are able to use this time to help the GPs. Locally, we have many extending primary care services which are similar to QOF, and a new one has just come on board to improve our cancer care. So the admin have managed to ring these patients in this new service so that the GPs can offer face-to-face consultations for patients who have had a new cancer diagnosis within the last 6 months. And this has improved cancer care and was a service that we were not offering locally before. There have been many benefits for the patients with the new registration system. The first one being that they only need to make one trip to the surgery. They're also not restricted to a certain registration time, and they can come anytime they want between the hours of 8 till 6:30. Using the time that we've released for admin, in the long term we would like to train one of our admin members to become a medical assistant. We're very excited to be part of the medical assistant pilot locally. This will require mentoring from myself and training time, but within a year we hope that we'll be able to release GP time, because at present each GP gets 40 minutes a day to read the hospital letters, and we're hoping that we'll be able to reduce that by 50% to only 20 minutes a day.